Now, if you're someone that is struggling with knee stiffness that is limiting your ability to restore your range of motion after knee surgery, then this video is going to be for you. Today, I'm going to cover the exercises that you must do to avoid this problem. Welcome back, guys. My name is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Today, we're going to be going over exercises that you must do in order to regain your range of motion in your knee after a knee replacement surgery. Now, if you haven't done so, I'd highly recommend that you take a look at my other videos where I go over some great exercises here that will help you get your range of motion back if you just had this procedure. However, I know there are many of you that are 6 months out, 12 months out, maybe even 1 to 2 years out. These are going to be some effective exercises that you can try that will help you, allow you to get back some of that range of motion. Now, the first exercise that we're going to go over is a seated hamstring stretch. Now, not just any seated hamstring. Now, I've gone over in the past how when you've just had knee replacement, you can prop up your legs in this position and really focus on that straightening. That is a motion after surgery that we often need to get back. However, we can challenge you a little bit more by using a yoga strap here. Now, what I'm essentially doing is I am wrapping the top of my foot here, and the use of the yoga strap is going to be pulling my foot backward. Also notice that I am sitting up, and that is an important point that you have to know, because if you're laying down, that's going to change the tension on the muscle of the back of the knee. This is focusing on hamstring flexibility as well as calf flexibility. And we can challenge you a little bit more by using a yoga strap to passively dorsiflex or flex the ankle backward, which is going to create a greater stretch behind the knee. This is an effective exercise that you can spend anywhere from 2 to 5 minutes with, and you're going to feel a lot of stretch. And over time, this is going to help you improve your ability to straighten your knee. Now, speaking of knee straightening, if you are someone that is struggling with this particular range of motion, this next exercise is going to be extremely helpful for you. All you will need here is a foam roller and maybe even some ankle weights, which I'll show you in a bit how you can use those. Now, the reason why I like the foam roller in particular is it will elevate your foot from the bed or from the ground, which is going to put a greater stretch on the hamstrings and the calf. The other reason why I like a foam roller is because it's firm. If you do this on your bed or like a soft surface, you're not going to get the full stretch that you want to get in order to fully straighten out that knee. So using a foam roller and placing it right underneath the ankle is going to be key. We don't want it along the calf. If we can put it just beneath the ankle, we're going to allow us to use gravity to help stretch this knee down. If you want to level up this exercise, maybe you want to make this exercise even more difficult, there's a few ways that you can do that. The number one way that you can do that is if you have access to ankle weights, you can place an ankle weight over the top of the knee. Also, you can place an ankle weight just below the knee. So let me rephrase that. The ankle weight is going to go above the knee right here on the upper thigh. And then the other ankle weight, if you have access to it, is going to go just below the knee. Guys, I'm talking about maybe 1 or 2 pounds. An ice pack, just the weight of an ice pack, bringing the knee down is going to help add some load to this specific stretch, and you're going to feel a lot of pulling behind the knee. We can hang out here for 2 to 3 minutes at a time, really focusing on improving that flexibility. And just a reminder, we are not placing the weight over the top of the knee on the kneecap. That is going to be painful, and that's not the area where we want to place that load. The second way that you can level up this exercise without using weight is by simply working on a tall sitting sit and reach. So notice when I'm doing this, I'm literally hinging at my hips. I have a nice tall chest. I'm hinging at my hips. I'm reaching forward as if I would do any other hamstring stretch. And when I do this and I go slow working on that pulsating motion, you're going to feel that tension get really tight as you lean forward, and then you're going to ease that tension as you come back. Same thing for 2 to 3 minutes. You can work on slowly just hinging back and forth, getting comfortable with this specific motion. And you're gonna feel this is going to be an effective exercise to help you restore that knee straightening. Now, if you're struggling to bend your knee, these next two exercises are gonna be extremely helpful for you. Now, what we're gonna do is we're gonna place the opposite leg straight. And what I'm now doing is focusing on bending of the left knee here in this position. Now, in the past, in my previous videos, I've shown some demonstration, which I think are greatly effective in using your hands over the top of the knee and bending your knee. This is a passive range of motion, and sometimes this can be a little too aggressive for many people. So if you're having pain with this particular exercise, it might feel better if now you can take your hands and you support the back of the knee. Now here, you're gonna allow the heel to just slowly drop down. Once again, we're allowing gravity to drop the foot down as I get a nice stretch over the top of the knee. You know that feeling that you have where people say, I just feel like there's a tight band over the top of the knee? This is a great exercise that's going to help with that. And all you're gonna do is just hang out here for a few minutes, and then once you can't tolerate this anymore, you're gonna slowly bring the knee down. You're gonna see that you might start off with this particular exercise and you can only tolerate maybe 20 or even 30 seconds at a time. That's okay. The goal is to eventually build up to your 2 to 5 minutes at a time. And over time, you may be able to tolerate that knee flexion exercise using your hands over the top of the knee. Now, the last exercise that we're going to cover is going to be an exercise for those of you who are struggling to get your knee flexion back. This is your ability to bend your knee. Now, notice I'm laying upside down, and the reason why I'm doing that is specifically because I'm allowing gravity to assist me with this exercise. After knee replacement, you're gonna have a hard time bending the knee on your own. You're gonna be very apprehensive. You're gonna be very fearful because of the pain that you're experiencing. This is why when we can use gravity to help with exercises, it tends to make exercises a little bit easier. Now, you can do this either against the wall, or if you can find some room where you're laying down on your bed, this is gonna be helpful, where your feet are straight up. I am focusing on knee flexion of the left knee. All you're gonna do, and you might be familiar with this, is work on your heel slide, but now you're upside down. All I'm gonna do is keep the heel down on the wall, and I'm gonna slowly lower the foot all the way down. Notice as I lower, I'm actually creating more knee flexion. Then I'm gonna slide my way back up. Also notice when I'm performing this particular exercise, I have socks on because this allows my foot to go down further. If I'm using socks against the wall, it's going to allow you to not have any traction, and you're not worrying about your foot getting caught during a bump on the wall or anything like that. So this is going to be an effective exercise, and you can perform anywhere between 10 to 12 repetitions where you're simply trying to bend your knee using gravity, allowing the heel to just go all the way down until you can really focus on that deeper range of motion of the knee. And you'll see over time, you'll be able to tolerate more of the exercises that are more aggressive to get this range of motion back. There you have it. Those are some proven exercises that you can use if you're struggling to regain your range of motion back after knee replacement. Now, if you found this video helpful, please support this channel by giving this video a thumbs up and subscribe below. If you want more tips on how to recover after knee replacement, make sure to check out my playlist here. In the meantime, I'll see you in the next one.